Mr. President, I had the privilege to speak on the nomination of Amy Coney Barrett a couple of days ago for her both qualifications and the uniqueness which she'll bring to the court, which will serve our country well. Today, however, I'd like to speak on a different topic. October is Breast Cancer Awareness Month, and I rise to pay respects to those who have lost their lives, to those who currently have disease, and those who work so hard to save these patients. A little personal, my wife, Dr. Laura Cassidy, is a retired breast cancer surgeon, so it's an issue which has always been very near to our house. This year it is estimated there'll be almost 280,000 new cases of invasive breast cancer among women and about 2,600 among men, often not realize that men are affected as well. And about 49,000 women are estimated to contract ductal carcinoma in situ, or so-called DCIS. And about 43,000 Americans every year will die from breast cancer. Breast cancer, of course, is hardest on the patient, but the diagnosis has a ripple effect through the family. I mentioned my wife, Laura, is a retired breast cancer surgeon, and she would tell me that when she would deliver the diagnosis to a patient, she would look at the woman and say, "You have breast cancer." The patient would be stoic, and her husband would cry. And it points to the fact that while cancer is a terrible diagnosis for anyone, when that anyone happens to be the center of a family, it radiates out from her diagnosis to touch everybody in her immediate family, in the generation above, and perhaps a generation below. We've been inspired to make our gains against cancer in general, but against breast cancer in particular, for the centrality that women play in our society, and of course the deadliness of breast cancer. And so it takes courage to address the disease if you have the diagnosis, and resiliency and determination just seem to develop in those who are so diagnosed. The support of family and friends means a lot more to the patient than the family will ever know. So I encourage those who know somebody with breast cancer in particular we're speaking of, but any form of cancer, to reach out. Simply being there can make a tremendous difference in the fight to survive. Now let me say, there is always hope. In addition to early detection, there are steps that people can take to reduce their risk of contracting breast cancer. Age is the primary, the primary risk factor, Mr. President. My wife used to say, when speaking to a crowd, the primary risk factor for breast cancer is being a woman. To emphasize that all women have a risk for breast cancer. So don't just say, because I'm not this or that, I'm not at risk. No, recognize that all women have a risk. Age would be the next risk factor, being that the older you are, the more likely that you can develop. Women who have children after age 35 may be at higher risk. The more children a woman gives birth to may lower risk. But again, the primary risk of breast cancer is being a woman. So every woman should take the disease seriously and take steps to reduce her risk for developing breast cancer, increasing the chance that it is detected if she does develop, and increasing the chance for a successful treatment if it does develop. Now, there are steps you can take to reduce the risk. Regular exercise can reduce the risk by as much as 20%. Breastfeeding lowers the risk of breast cancer. Eating fruits and vegetables, especially carotenoids, which is in carrots, as you might guess from carotenoids, avoiding obesity, moderation in drinking alcohol, all can reduce risk, all should be practiced. Now, though a cancer diagnosis can be shocking, again, you can do things to detect it at an earlier stage and improve the chance of a successful outcome. The American Cancer Society advises women 40 to 44 to consult with their doctor for regular clinical exams and on guidance as when it's best to have a mammogram. Women who are 45 to 54 should have an annual mammogram, and those older than 54 and in good health should have a mammogram every 2 years. But again, check with your doctor. All these need to be customized for the patient. Patients should also do self-exams for warning signs. This could be the change in the look or feel of a breast or possible discharge from the nipple, the presence of a lump, swelling, discoloration, changes in size and shape are common signs. If these are present, she should consult with her healthcare provider. If someone doesn't know how to do a breast self-exam, look on the internet. There are all kinds of resources that can help somebody know if they're just not sure how to do. Lastly, the treatments for breast cancer continue to improve. The surgical, radiation therapy, and medical therapy is improving every year. A diagnosis of breast cancer is not a death sentence. It is the beginning of a treatment regimen which can cure. Now, by the way, let me diverge just a second from October being Breast Cancer Awareness Month to kind of the contemporary things that we're speaking of. My Democratic colleagues on the floor have been imagining how a Justice Amy Coney Barrett would rule on various topics, frankly saying things that are designed to cause fear, and they're doing it for political gain. But I think everybody on this side of the aisle, all Republicans, have a commitment to make sure that all Americans have health care and that they have coverage for pre-existing condition. Again, I'm a doctor who worked in the public hospital system for many years, but some stories particularly stand out. This is a patient of my wife's, and she was probably about 45, 3 children. Her husband had died or they divorced, I forget which. They lived in a very nice neighborhood in my hometown of Baton Rouge. She drove a nice car. But when her husband left, however he left, she had decisions to make. And she made the decision to go without health insurance so she could afford other things for her family. At some point along the way, she felt a lump in her breast. But without health insurance, she didn't know what to do. And my wife was a breast cancer surgeon in private practice, but eventually someone connected this patient with my wife. And when she came to see my wife, she had waited so long for evaluation that the cancer was growing out of her skin. It's called fungating, like a mushroom grows out, except it wasn't a mushroom, it was cancer eating through the skin. Now, and she had everything otherwise. Great house, good car, wonderful kids in parochial school. Now, it's that sort of example that touches us all, that lets all realize that there is a personal reason why we all care about everyone having access to health care, why we all care about folks having coverage for pre-existing conditions. I give congratulations to my colleague sitting in the chair, the senator from North Carolina, who has had a bill up that would address pre-existing conditions. But on several occasions, my Democratic colleagues have objected to your bill being passed that would protect those with pre-existing conditions. So I will end this paragraph where I began it. As I just digress a little bit from October Awareness, Breast Cancer Awareness Month being October, I will point out that my Democratic fellow senators raising the issue of pre-existing conditions in the setting of Amy Coney Barrett seem to be doing it more for political gain, because the bill that my colleague from North Carolina offered would have addressed the issue, but they opposed it uniformly, as if they want an issue to campaign on, but not a solution to the problem. So let me conclude. As October comes to a close, let us reflect on breast cancer victims not only in the final days of Breast Cancer Awareness Month, but throughout the year. Know the risk factors, know the warning signs, and screen regularly to catch early. Doing so saves lives. It is important for the person who may have breast cancer. It is important for us all. Thank you, Mr. President, and I yield the floor.